Hello and welcome. I am Julia McCabe with American Frontline Nurses, and today I'm going to show you how to use a pulse oximeter and what signs and symptoms to watch out for hypoxia. So this is one that I got off of Amazon. You can get these anywhere from Walmart, CVS, Rite Aid, any of your local drug stores or your local medical supply. So I'm going to show you how to use this. They are battery operated. So mine takes two AAA batteries. You just want to make sure that you have new batteries in when you're using this the first time. And then if you use it quite often, you want to change the batteries quite often. They're very simple to use. You push the button to turn it on. It's going to give you a reading of your pulse ox on the top and heart rate on the bottom. So you put your finger in and it will register. So with this, it's going to register your pulse ox along with your heartbeat. And if you can see, I believe 99 and 100 is where I'm at right now. So you always want to make sure that you have no nail polish on your hands. Not wearing any nail polish because it needs to be able to read your pulse ox through your nail bed. So that is how you do the pulse ox. As soon as you take it off, it is going to go back to the normal screen. And then again, you would just put that back on. If your fingers are extremely cold, it may not register properly and it will give you a false reading. So make sure that your hands are nice and warm. And if your hands are not nice and warm and they are starting to turn blue, that is a sign of hypoxia. So if your oxygen rate is 88 or below, you're going to need to reach out for medical treatment. However, the signs and symptoms of hypoxia are slow heart rate, sweating, wheezing. So if you're having trouble with your lungs and you're unable to take a deep breath, that's one sign. Confusion. So if your oxygen is too low, it could affect your mental status, unfortunately. And you would be coughing. So if you're coughing and you're unable to get full breath in, your oxygen saturation can go down as well. Fast heart rate, rapid breathing. So I kind of think of it as guppy breathing. So rapid breathing, and it's like a fish, like their gills are going back and forth. So unable to formulate a sentence. So if you're unable to speak, a full sentence without getting out of breath, then it's very possible that your oxygen saturation is too low. And again, if it's under 88, you would want to reach out to a medical professional and be evaluated. However, if it's 90 or between the 88 and 90, there are things that you can do to be able to increase your oxygen saturation, as in using an inhaler if you have one, nebulizing if you have a nebulizer, and taking nice, deep, slow breaths to make sure you get enough oxygen into your system. And that way you're not just shallow breathing and you're not making yourself worse by not being able to get, if you have mucus or anything in your chest, you're not getting that out. So the nebulizer is a very important piece to making sure that you have your oxygen saturation high enough. And again, it's very easy to use. It's a push of a button. This one I got on Amazon, and I believe it was right around $19 or $20. We'll have a link down below in our video with all the instructions on how to use a pulse oximeter. And again, as always, we always thank you for your continued support with American Frontline Nurses. And if you're able to donate to our foundation, go to AmericanFrontlineNurses.com and push the donate button. That allows us to be able to do our Telegram, Ask an Advocate chats, and also do our weekly Tuesday and Thursday Ask the Advocate Zooms. Thank you very much.